Nucci from Nucci Medical. Thanks for joining us for our Friday coffee talk with our coffee right here, Nucci Medical Coffee right there. Today's topic is on PRP injections in orthopedics and in spine. And PRP is popular. It's being used throughout orthopedics and even in spine. And we have here at Nucci Medical fairly extensive experience with PRP. We've actually began using it long time ago. I think about 2000, something like that. When it was actually called something else. It was called AGF at that time, autologous growth factor. But it changed its name along the way to PRP, which is platelet-rich plasma, or platelet-rich, essentially platelet-rich plasma. I think that's the only name now that they have, but AGF was what it was before. And people injected, physicians and I guess maybe others, inject it into muscles, joints, and some people even inject it into the joints of the spine, even around the nerves in the spine, and so on, even into the disc itself. I have our disc model here. Here's our disc model, our vertebral body. You can see that or not. Anyway, so people inject it into the disc itself to see if they can help it regrow or be less painful. I mean, we have experiences with all of those things. So as far as what PRP is, the best way I can explain it, I think, is the way I explain it to patients, and that is what happens when you have an injury. So if you get a cut, for example, on your hand or anywhere, it will heal. Usually it's going to heal. You'll probably fine, barring anything crazy, it'll heal. But when you get that injury, the first bleeding type injury, the first cells that really get there and start working to heal that injury are the platelets. And when the platelets arrive, or when the platelets are stimulated, when they're there, they release something called platelet growth factors. So these are proteins that are released, and it's a signal to the other cells in the blood, other cells in the body, that there has been an injury, and to mobilize and start healing that injury, including stem cells that are in marrow and so on. So they're mobilized to this area to begin the healing process. So platelets start that process essentially. Now, platelet growth factors are this. We discussed what it is. It's a signal, but how to get it is this. You draw someone's blood off, a tube of blood, not very much, then you spin down or concentrate down their platelets into and their growth factors, concentrate them down into platelet-rich plasma. So you essentially have that healing ability, natural healing ability, in a concentrated form, and you can inject that in various areas. And when you inject it, it's a stimulant to the body to get that healing process going and sort of jumpstart it and get the area healed. And it does work. It works better in certain places than others. It is very helpful, in my opinion, and in others. Injecting it for a knee injury, this is cartilage injury in the knee, shoulder injuries, rotator cuff tears, deep muscle injuries in the shoulder. It can help those things to heal. I tell patients it's not a pain treatment. It's not like a steroid injection or something. It actually heals. However, it begins the healing process. So actually, it can hurt even more when you give it. And over the course of usually a few days, it starts to improve. So it's actually fairly dramatic. Now, experience that I've had is it doesn't work that great with really arthritic things. So somebody with a very arthritic knee, and it's not really that great. There's maybe other ways to do things for that, other kinds of injections you can use, which we may discuss in the future coffee talk. Not my experience, not that great. But for a cartilage injury, someone who doesn't have much degenerative changes in their knee or in their shoulder, or shoulder muscular injury, deep muscle injury, rotator cuff injury, it can help. Even muscle strain injuries, they are persistent, have a trigger point, which means that there's one spot potentially that really hurts as you press it after an injury. Any injection of PRP into that can help that also. There has been use of it in the spine. As I said, people inject it into the disc. And this is more of a controversial area. in the sense that there's no clear-cut answer. But I'll give you what I've experienced, and that is it really doesn't work. Unfortunately, I certainly wish it did. We certainly do a lot of different kinds of injections, but hasn't really shown to be very helpful. I haven't done it into the disc, too, also with consent, of course, in surgery and otherwise. And truth be told, it seems to help a little bit, but that's anecdotal. But from my experience, and it hasn't been dramatic. You know, sometimes you do things you're like, wow, that's dramatically better. We're going to study this deeply. I haven't seen that, unfortunately, in the spine. Why? Spine is a different animal. The different joints are different animals too. The shoulder is not a knee; they're different things, and the spine is clearly something of different nature. It's got all different kinds of joints in there. It's got a different structure to it, different functions. It just doesn't seem to work that great. I know there are those who swear by it, but I have not had the experience that it's very helpful at all. But in the joints, it can be, and it can be done, you know, outpatient. You can do that in the clinic, have the blood drawn, spin it down, and so on. You need special kits to do it, but it can be done, and it can, you know, help. So for those that want to know about PRP, I think we have on our website some information on how PRP is prepared, and maybe I think some of the things it's used for. So PRP, platelet-rich plasma, is good. Now there is a bit of new information about how much of the white cells to add. So you have blood, it has red cells, it has white cells, it has platelets, this kinds of thing. You spin them down and they separate out because there are different densities. And sometimes they say, well, let's add a little platelet poor plasma in this. In other words, not that many platelets in this one, just the proteins, platelet factors, or let's add platelet rich plasma, which has more platelets, and then let's add a few of those white cells in there too. That seems to help. And that's probably the case. We're still working that out, which is the best for different things. It seems that adding a little bit of white cells or a certain amount when you're injecting a tendon like an elbow is maybe a bit better than just using platelet-rich plasma or platelet-poor plasma. So that's a bit of a debate exactly how to do it, but it does seem to work for joints and for chronic muscle pain in one spot or two spots. You can use that PRP for that. And that's my experience, and that's some of the latest news on PRP, formerly AGF, now PRP. And hope you guys got something from this. And as I say on the website, there is some more videos on PRP injections if you're interested. Let's see if there are any questions today. Oh, here we have one right now. I got my glasses adjusted. All right. I think I'm going to sip some coffee first. I think. Let's see. PRP injections help avoid surgery. Okay. And PRP injections help avoid surgery. Well, there is some a little bit of debate. Maybe it's being worked out right now. Initially, when PRP injections were given, it was thought to be for inflammation. In other words, you give it, it decreases inflammation. It doesn't really heal anything, just sort of decrease inflammation. There seems to be some evidence that it does heal something, shoulder injuries, knee injuries. So it can heal an injury that otherwise may not heal or heal as quickly. So to the extent that it does do that, or decreases inflammation and makes things less painful, you can avoid surgery being done for a painful process. In other words, if your knee is hurting, your shoulder's hurting, you're like, that's killing me, I got to do something about it. I need to be operated on to fix it, and you have a PRP injection, and you're better, then you're like, well, I avoided surgery now. But there are the kind of surgeries it's not going to help. And obviously, if you fracture your knee, it's not going to help that. And as I said earlier, there's some arthritic conditions in the knee, and I think the shoulder too. It just doesn't seem to help. So if somebody has bad knee arthritis and they're thinking about a knee replacement, a PRP is probably not going to do anything, at least in my experience on that one. There's other kinds of injections that you can use there that probably will work, that probably do work better. And again, that can be another topic. So it can avoid surgery if you're on the edge and it does make you better. You don't have some structural injury, right? Like a fracture or something structural. The knee is crooked because it's arthritic. It's not going to help that kind of thing. Let's see. That was a good question. Let's see if there's any other. There's another question. Well, that's a good question too. It talks about blood type and PRP. No, blood type it doesn't relate to the platelets, so it doesn't really matter as far as research I've done and knowledge I have that there's any effect of blood type on PRP or on the platelets. They're a separate part of the blood, and the blood is has lots of different kinds of cells in it. As I said, mentioned white cells. There's lots of different kinds of white cells. There's groups of them, red cells, and so on, and other things too, proteins and things that are floating in the blood. And platelets are one of those things. They are not related to blood type and not affected by blood type. Now, they are affected by other things. You can have a low platelet count for many reasons. Malnutrition, diseases, or you can have platelets that have lots of them and they're just not working that great. So these are other associated diseases we worry about in surgery because platelets, as I said, help stop bleeding. They're one of the first things to get there. We think of them as the little sandbags that for a river or an overflow, little sandbags of the platelets, and then the proteins go around it and first fill it in like glue or like sand or like cement. So if your platelets aren't working that great, or you don't have enough of them, you can have more bleeding than we would like to see. Things like aspirin affect platelet function, so we worry about those kinds of things. But as far as blood type goes, doesn't affect platelets, and different blood types make no difference as far as I know in anything related to platelets. It's certainly nothing that's in the literature that I've come across. Or in using it when we use these things. There's no contraindications or changes with one blood type versus another. So I would say no, blood type has no effect on PRP. Let's see if there's any another question. Oh my goodness. All right, what is the difference between what is the difference between cortisone and PRP? I think I sort of touched on this. Cortisone is really not used per se anymore. Cortisone is a steroid. We say, it's cortisone shot. It's usually a different steroid than cortisone, although you can use it. Cortisone is as I mentioned, a steroid. Steroids decrease inflammation. They work on the body in a way to decrease inflammation in an area. And PRP is partly decrease inflammation, as I said, but also is potentially a healing thing also, which cortisone really is not. Cortisone is a medication, it's one thing. PRP is multiple proteins and platelets too, and maybe white cells. So it's a vast conglomeration or a collection of things. Well, cortisone is one medication. And cortisone is to decrease your and can have certain side effects. Also, PRP is, of course, your own body's PRP, your own body's healing ability, as I said, in concentrated form. So it's a different different thing entirely. Both are given for pain, and both do work for pain given into the right area of the joints. Now, cortisone, since I sort of touched on cortisone, PRP in like very arthritic knees, and cortisone does work for that. It may not stop you from having surgery, but it does actually work for those kinds of things. And people do get cortisone or steroid really injections into their knees, shoulders, and elsewhere for arthritic conditions. Even in the spine, we use steroid medicines for inflammation and for pain and so on. So it's different. It works a different way, and it's another tool we have to help people. Let's see. I think we're almost at 15 minutes, so we're almost going to end anyway. So again, thank you for joining us for our Friday coffee talk. And if you have any additional things you'd like to hear about or questions about topics that you maybe don't understand or would like to understand more about, let us know by email. We can add those on to our coffee talks going forward. I think that's all. Thanks very much. It's Dr. Nucci from Nucci Medical. Boston behind us, or my sister is a professor, and my husband, professor over at Harvard Medical School. So we decided we honor her today with Boston. So have a good day.